Hi, Marissa.
Hello, Asim.
So it's good that we're finally having this chat. You know, it's really nice that we can start with this as our first talk. I think chronic pain is a really important subject and something I want to talk about quite a lot.
Absolutely.
So yeah. Did you want to talk about what integrative medicine is generally, or do you want me to say what that is?
Sure, yeah. So first of all, maybe I'll just introduce myself quickly. My name is Marissa. I'm a nutritional therapist and also an integrative health practitioner. So obviously, we want to talk about integrative medicine here, and you can add anything you want. I will just start by saying what I think people should be aware. So, integrative medicine, it's a field that is here to combine both approaches, the conventional one and the complementary one. So it's kind of knowing we are very blessed to have conventional medicine that is great to treat some diseases for diagnostic, but we also have some practices, traditional practices that can really work. And when we combine both, it's when we optimize the healthcare we can provide to patients. So I think in a very summarized way, I would say this is what integrative medicine represents for a general public.
Yeah, no, that sounds about right. Yeah. And Deb, can you tell me a little bit about your experience and what you've been doing so far with nutrition?
Sure, yeah. So I combine both sides. So I work in nuclear medicine and bone density as well. And then I'm working as a integrative naturopathic and nutritional therapist. So my experience is mainly with women's health, gut health, hormonal imbalances, stress management as well, and preconception. Recently, I've been following some pregnancies as well, which I'm really delighted to do because it's an area that is really of my interest. But yeah, so I do end up touching a bit in chronic pain as well, especially with some patients that have fibromyalgia, for example, patients that suffer from osteoporosis and linked to that. Sometimes do they have arthritis, rheumatoid arthritis as well? So I ended up um, dealing with some patients with chronic pain as well.
Okay. Would you say there's a specific types of chronic pain that you deal with then? Is it that sort of that kind of thing, that fibromyalgia, which is more of a general chronic pain?
Mhm.
Um, and then musculoskeletal pain as well then with the osteoporosis and the rheumatoid?
Yeah, exactly. Obviously, with osteoporosis, it's usually it's not because of osteoporosis, because it's usually osteoporosis is a very silent disease, isn't it? But with all the associated diseases to that, so people do come with rheumatoid arthritis, like I was saying, with hip pain as well.
Mm-hmm.
So yeah, so and yeah, fibromyalgia as general pain.
So when I ask people the question, what kind of information would people want from you? Everyone always has a very general response, is what can you tell somebody? And I know this is a really awkward question, maybe, but what would you, if you had to say something to somebody who doesn't specifically have chronic pain or any particular condition, just the average Joe, which, again, that's so vague. But if you had to say something to somebody like that, what would you say that they could do that will be better for them nutritionally?
Yeah, so I think there are three nutrition X, let's say, that I think people should be aware, especially with dealing with chronic pain or if they want to prevent that as well. The
Mhm.
first one is obviously having or adopt anti-inflammatory diet.
Mhm.
So getting away of sugar, processed food, omega-6 foods, it's very, very important that people are aware that there are foods that probably they consume in their diet that are high inflammatory. And obviously, because with chronic pain, we are also talking about inflammation. If we keep having this type of foods, it's kind of triggering and flaring this inflammation as well and the pain. So moving away, like putting aside all these processed foods, sugar, refined foods, and moving more for all foods, so fruits, vegetables, fatty fish, all grains, some seeds. This can then help people to reduce the inflammation in the body. For some of them, they will reduce weight as well, although I will never. So, my approach is never to tackle, a weight loss straight away, because I do believe there is something behind the weight loss or the gain of weight, let's say. So, there is something behind that we need to correct before we just focus on weight loss. So, obviously, as a side effect, by changing the diet and moving away off some foods and getting more in an anti-inflammatory diet, people will lose weight as well. And by losing weight, they will also feel better in some chronic pain diseases.
Yeah.
Yeah, so I was going to say, I did say 3x, so I was going to say that's the first one. The second one, you did mention in one of your stories, omega-3, which is super, super important. And I feel in general, some people. So let's just do a disclaimer before I start talking about supplementation, because obviously people can get supplementation over the counter and without any guidance of any specialist. And I think people need to be aware that this is not the correct way of doing, because although supplementation is not as legislated as the drug industry, supplements are also very important and they can indeed make a difference, but we need to know the dosage that we are taking, the quality of the supplement. Some of the supplements, they're not worth taking at all.
Mhm.
So if you want to use a supplement, maybe try to find a specialist and try to see which supplement will be good for you, because sometimes I can take one supplement that really works for me, but you can take the same and doesn't do anything, or you feel even worse with that. And some supplements will also interact with conventional medicine. So it is very important to be guided by a specialist. So, with that said, omega-3 is really good and can be very, very good for people that start having some clicks in the joints, that they
Mhm.
wake up in the morning and start clicking, like, oh, that's so odd, what's going on? Omega-3 can really make a difference. Again, they are pro-inflammatory eicosanoids, and it's really, really beneficial to take them in a chronic pain scenario. The last one I would say, and I think I don't remember, I think you mentioned as well, it's magnesium and vitamin D. Obviously, vitamin D very anti-inflammatory as well and very important for bones. Magnesium also supports the muscle. So again, both of them are essential. And people can start by exposing to sunlight, although we really need to make a disclaimer here about the the sun and hours of exposure. It is a balance that we need to do. Another day I was talking with one of my colleagues, dermatologists, and he was like, you know what? I would rather just take a vitamin D supplement than to risk myself to have a melanoma. And I totally agree as well.
Yeah.
So yeah, so these are the three ones that I think would make a difference in general,
Yeah.
but it can be very specific to each patient.
So yeah, I know what you mean with the overall theme, that sort of connection between chronic pain and inflammation. That's really important, you know. It does play a big role irrespective of the type of pain. So that's a very, good general thing to be aware of is, try and do what you can to reduce your inflammation overall. There was one thing that you said, which I know of it, but I'm a bit confused by it as well sometimes, is you said the fish oils or the omega-3s are inflammatory, is that right?
No, no, they are anti-inflammatory.
Anti-inflammatory. Okay, fine.
Yeah, yeah.
Okay.
So if we talk about if we talk about omega-6, They
Mm.
are pro-inflammatory. The omega-3s, they low the pro-inflammatory eicosanoids, and that's what that's what I meant. Maybe I did
Fine.
express myself
Yeah.
well, but that's what I meant.
Perfect. Fine, 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 fine. All right. And some one of the questions, like saying somebody had asked about magnesium specifically. So what sort of role can magnesium play then with chronic pain, would you say?
So yeah, so magnesium. First of all, it's a muscle. It can relax muscles.
Mhm.
So it can help by improving the muscle function as well. And then magnesium has the power of reducing sensitization as well, which is very important for someone that has chronic pain. Also, there are different types of magnesium, and we need to be aware of that. And that's why it is tricky to say, well, everyone should take this X type of magnesium because it really depends what we want to tackle.
Mm.
Obviously, we have magnesium citrate, magnesium biglycinate, but it really depends what we want to tackle and the history of each person as well.
Yeah, so and again, I think looking at the whole theme altogether, so what you're saying is generally you suggest people have a whole food diet, but then in these specific situations, maybe a supplement does make more sense.
Yes, because if you already have a chronic pain,
Mm.
you you can reduce like inflammatory foods, which is really good.
Mhm.
You can move to a more healthier diet.
Mhm.
That's great. But then to really have a therapeutical effect, you do have to use some supplements, especially if you have low vitamin D, for example.
Mm.
So you do have to supplement.
And specifically with magnesium, is that because this question comes up sometimes as well as what about people who have an adequate amount of meat in their diet, particularly red meat, and let's say they're also having, whole grains and things like that. Is it possible for them to be getting enough magnesium?
So nowadays, bear in mind, magnesium is one of the minerals that is really, really used in stressful situations. So by our nervous system in general. And I would say in a city environment, in our day-to-day stress life, I
Mm.
think having a supplementation can really help if people already have chronic pain. Even if people don't have chronic pain, sleep issues, magnesium can help as well.
Mm.
Anxiety, um, period pain. So magnesium is really, really powerful, and we probably don't get enough with the food we eat nowadays.
Yeah, I mean, getting good sleep is vital to, make sure that you're well rested and the pain is better anyway as well. So it's one of those factors. And I was just saying to somebody the other day as well, which another thing that people don't often realize is simple diet related intervention is making sure well hydrated. A lot of people
Mhm.
don't realize having a good amount of water, and this is often the reason why beans can often feel a little bit worse in the mornings as well, just because you're that little bit more dehydrated in the morning. So
Absolutely.
yeah,
I always say the same, like start your day with a glass of water, brush your teeth, and then have a full glass of water. It doesn't matter if you add some lemon or not, because there's people that like to have a lemon.
yeah.
But to be fair, lemon, there's no scientific evidence that says lemon will do anything. But actually, it tastes better. So if you want to add lemon in your water, go for it. But have a full glass in the morning.
Okay. So one particular question somebody had was, so this guy is relatively fit, exercises quite a lot. He feels like as he's getting older, so he's sort of coming to his 40s, he's feeling more fatigued overall. He's noticing that there are more aches and pains than there were before. He isn't sure whether this has something to do with his diet and because he doesn't feel like he has the cleanest diet.
Okay.
He's wondering could a change in the macros, so carbs
Mhm.
and protein and things like that, could ma that make a difference to him, or is it? It could be a host of other things, but could that also
Mhm.
help? Yeah.
How old is he? Do you know?
38.
Okay, so he's still quite young.
Mhm.
Um, in terms of protein, we should be increasing protein, especially in elderly people after 60, because it's crucial because of the muscle loss. Although in the 38 years old, still quite young. Um, Although if it does exercise, protein is essential to support muscle mass and strength. So it is important to have a good apport of protein in his diet. When I say good apport, can be around 1 gram of protein per kilogram of body weight. But I would always say, like, make sure you include protein in every single meal, breakfast, lunch, and dinner. Or if people just have 2 meals because they do fasting or something, make sure all the meals you do, you have protein. It's super important. I used to say they are the building blocks of our body. They're super important as well because they break down into amino acids, and amino acids are then super important as well. For example, glutamine for the immune system, the gut health as well. We also have tryptophan, which is essential for serotonin, which then improves our mood and also modulates the pain perception. So it's very, very important that we do have enough protein in our diet and good quality protein. So we're talking about oily fish, legumes, eggs. They also are known for reducing inflammatory markers. So ended up helping in general as well. So I would say not only increasing protein, I would say that is important to have other things in the diet and good quality protein.
Mm,
That's the main thing.
right. Another, I think, question when you're just, it's also a whole food versus supplement question, I guess. So yeah, in the older category, sort of maybe 60 plus, you tend to accumulate all those little joint aches. Some of it probably has to do with osteoarthritis. Would I think there's two supplements that were quite popular before. I don't know how popular they are now. Is glucosamine and chondroitin is the other one, I think.
Yeah,
Yeah, yeah.
yeah, for joints in
Mm-hmm.
general.
Mm-hmm.
Yeah, and it is still part of some protocols when you want to do some joint work. Yeah,
Is
there.
that-
It's not the go-to. If you have chronic pain, I wouldn't straight away go to those two, but it can help in some cases, especially when it's affecting the joints.
Is that something that people could get adequate from their healthy whole food diet if they're going to go with that?
Again, if we just want to do maintenance, probably, yeah, you
Mm.
can look into foods that I have high levels of these two supplements. But if we want a therapeutical level, then we really need to go to supplements and increase the doses for a period to then be able to maintain that with lower doses or just with food.
Right. Okay. Okay. So it can be a situation where you can just build it up to a point where, let's say, the pains have gotten better, and then just simply going to that whole
Exactly, and
food.
then you can move to something else that really helps just to maintain and prevent having some sort of pains again.
Hmm. Okay. Great. Yeah. With the inflammation generally, is there any other supplements that you would suggest apart from the ones you just spoke was any sort of anti-inflammatory supplements or anything that can be helpful?
So in general, I would go for vitamin D, magnesium, and omega-3.
Uh-huh.
More specific situations, you could use the two you just mentioned, or you can also use curcumin. It's also one option, and it's also very well known to control chronic pain. And again, for example, with curcumin is something we can use daily in our food, and that's good to add a little bit and prevent, or at least we absorb some curcumin. But when we are talking about someone with chronic pain, then it is needed to supplement because they, again, like like I was saying, omega-3 curcumin also is responsible by blocking pro-inflammatory cytokines. And that's great when it comes to chronic pain because that's exactly what we want. Um, it's also antioxidant, also modulates some pathways in the pain mechanism. So curcumin is also very relevant for chronic pain. Although we need to look at the right dose to the right patient, probably do a protocol for 6 weeks, assess how someone is doing, and then see how we move forward. But there are some studies already in the role of curcumin and osteoarthritis, for example, and rheumatoid arthritis, which I think are quite good.
Right. I think that covers most of the questions that people had. There was one other general one, not related to chronic pain, but related to some of the things you're mentioning. So this was mentioned earlier. So this was about gut health, and somebody'd come across a supplement called chlorella, which is
Mm-hmm.
like spirulina. It's this algae type of thing that you can have.
Mm-hmm.
And they had seen a video or something where it was mentioned that it can help with improving your gut
Permeability.
permeability, yeah, reducing the permeability. Yeah.
Yeah.
So do you know anything about that one? Have you heard anything about that?
No, not really, but I do. I do. So chlorella is well known in several areas. So again, antioxidants. So I don't really have experience of chlorella in gut health. I would use other supplements before, and with gut especially, I would use lots of food.
Hmm.
So then it's a lot about diet, changing the diet, maybe do a low FODMAP diet for a period, see how the gut is healing. But yeah, chlorella is, I'm going to research more about that, but it's probably something that can help. I don't know if there are many studies that support that.
Perfect. I think that covers everything for today.
Right. Yeah, no, that was great.
Yeah. Thank you so much for your time.
Oh,
And
thank you. Thank you for inviting me. That was very good.
thank you.
And I
Thank
hope
you.
people are also finding these useful.
Yes, yeah, yeah. And I'm sure we'll do another one again soon. So,
That's it.
yeah.
All righty.
Yeah.
Thank you.